Alright, I'm doing section 3. I'm going to be doing the head of table thumb spinous push. I'm going to be on the side that I contact. I'm going to be in a square stance. Table. I'm going to make sure my headpiece is face down. My segmental contact point is going to be the inferior lateral aspect of the spinous process. I'm going to be using the tip of my thumb as my contact point. So I'm going to be on the side of the spinous. I'm going to ask my patient to turn the head away. I'm going to be pulling up. My tissue pull is going to be A to P, I to S, and I'm going to use my stabilizing hand and I'm going to put it over the patient's mastoid. My force generator is going to be straight lateral to medial using a pec twist. And my line of correction is lateral to medial with my forearm and parallel perpendicular to the floor. I'm going to be performing the seated index pillar push. I'm going to pretend like it's a left rotation restriction. My patient position is going to be seated. I'm going to be behind the patient. I'm going to be on that articular pillar with my right index finger. I'll be standing towards the patient's right side behind. My stabilizing hand is going to be over the tip of the mastoid and the cheek, fingers facing down. I'm going to have the patient lean into my contact. I'm going to get a tissue pull, P to A, medial to lateral, and be again on that articular pillar. My line of correction is going to be P to A, I to S, and my elbow is going to be in that outward alignment. My thrust is going to be pecs and triceps. Perfect. Alright, I'm going to be doing the prone pillar index push. I'm going to be on the right side in a fencer stance. My contact point is going to be the lateral aspect of my index finger, of my superior hand, my right hand, and my segmental contact point is going to be the posterior aspect of my right articular pillar. I'm going to ask the patient to turn his head to the side. My tissue pull is going to be P to A, medial to lateral, so it's going to go left to right. And then my inferior hand is going to be my stabilizing hand, and that's going to be on the left mastoid. I'm going to come in here. My line of correction is going to be P to A, I to S, or S to I, just depends on which segment you're on. And my thrust is going to be pecs and triceps. I'm going to be doing the hypothenar seated. I'm going to be contacting the, my contact point is going to be with my left hypothenar. I'm going to reinforce with my right to my stabilizing hand. I'm going to ask the patient to lean back and they're going to turn their head towards that favored side. I'm going to come in with my left hypothenar and my tissue pull is going to be P to A, I to S. And then I'm going to reinforce my right hypothenar. I'm going to ask him, or I'm going to bow my chest out a little bit. And then my line of correction is going to be I to S, or lateral to medial I to S, or a lateral flexion restriction. And I'm going to be scooping and lifting with my arms and my traps. Alright, I'm going to be doing the supine, contralateral, anterior thoracic adjustment. You can pick which either side you want to stand on. So in this case, I'm going to stand on the patient's right side. I'm going to ask my patient to cross over the side of contact that I'm on first and then cross it over with that other arm. I'm going to then ask my patient to lean over this way. I'm going to be contacting about T3. I'm going to be with a closed hand as my contact point, and then my segmental contact point is going to be on that left TVP. I'm going to use my stabilizing hand on that inferior elbow. There we go. My tissue pull is going to be P to A, I to S, and I'm going to have the patient breathe in and out. I'm going to transfer my body weight to tension, and then I'll deliver thrust. My thrust is going to be A to P, I to S, and it's going to be a body drop through the doctor's torso. Ooh.